Good morning, everyone, and welcome to our first virtual NET patient conference. I first want to thank our generous sponsors, Lexicon, Ipsen, Novartis, Sun Pharma, Intrinsic Health, Curium, and Nebraska Cancer Specialist. Please make sure that you stop by the sponsors' rooms and talk to the reps and download their materials and learn more about their products. Now, let's talk a little bit about NCAN and our advocacy. This all started when my journey began. In 2001, I was misdiagnosed for 7 years. So I was diagnosed in 2001. And in 2003, we started NCAN. We started this NET group because when I got diagnosed in 2001, at the time, there was only the Carcinoid Cancer Foundation. There was no Facebook. There was no sites to go to besides the Carcinoid Cancer Foundation. I got diagnosed on a Thursday evening at 4 o'clock. And unfortunately, the Carcinoid Cancer Foundation didn't open up again until Tuesday. So all weekend, I spent on the computer looking up to find out that I was going to be dead in 5 years, which now I am celebrating 19 and a half years. So we know that was not true. We were the first organization to use the zebra. And now all of the groups use the zebra as their logo. Now, many believe that the reason we chose the zebra was because in medical school, they're taught, when hearing hoofbeat, think of horses, not zebra. Look for the common, not the uncommon. But the truth of the matter is that Bob and I chose the zebra to be our logo because each zebra has different stripes. Each NET patient has different symptoms and different response to medication differently and things like that. Their fingerprints on the zebra are their stripes. So that's the real reason why we use it. We also were the first ones to be approached by Novartis to help start the first worldwide NET Cancer Day. So we hosted our first meeting in September 2009 down in New Orleans. And we're very excited to be part of that journey of getting NET cancer awareness to be out there worldwide. We are really excited because we have people from all over the world coming today. We have people in Australia, New Zealand, we have Ireland, and we have United Kingdom, and we actually have somebody here from Africa. So welcome, and welcome to our family. Many of you might not know that, but NCAN is really a family, and the NET community is a family. You're not on this journey alone. There are plenty of us out there. So make sure that you interact with other people, go into the chat rooms and talk to other patients and caregivers and get as much information out of this meeting as you can. We have some really great presenters and we're really excited that they're here. So let me tell you a little bit about my journey and why you need to be your own advocate. For many of you know that I was diagnosed in 2001 after being misdiagnosed. And during that time, I saw 7 different doctors. And all of them told me different things. They told me I had ulcerative colitis. They told me that I had Crohn's disease. I was told that I was crazy. And yes, I know some of you are going to say I am crazy. Yes, I am. But they did. They actually told me I needed to go to a psychiatrist. At one point, one doctor actually had the nerve, while Robert and I were sitting there together holding hands, to tell him that this was all because I was in a bad marriage and that we should go to marriage counseling. And I turned around to the doctor and I said, well, if I needed marriage counseling, I don't think my husband would be actually sitting here with me going through this journey. So I found that I needed to be my own advocate. I needed to realize that it's okay to fire your doctor. If your doctor is not giving you what you need to find another doctor. If you're not getting what you need from the doctor's office, you need to complain. If they're not sending your records, if they're not responding to your calls, you need to complain. Keep pushing. You have that right. You need to remember, as a patient, the doctors work for you. You do not work for the doctors. And you need to make sure that this is taken care of. You also need to be an advocate and try to, at least once in your lifetime, get to a NET specialist. I'm not saying you have to stay with them forever. I'm just saying to get there and make sure that you're getting the right treatment. If you go to your doctor's appointments, it's a really good idea to bring somebody to listen to when your doctor is speaking to you, because a lot of us get really nervous and we forget what we are told. Also, take
You are the
notes
last
before you go to
party
the
in the
doctor's
conference.
office, and bring a notebook with your questions. And this way you have an idea of what questions you want to ask and when. If the doctor can't answer all your questions at that time, leave them with the doctor and ask them to answer them at a later date. Make sure when the doctor says what's going on, you don't just say, I'm fine, everything is fine. If they say, how's your diarrhea? Don't go, oh, it's okay, it's not that bad. You have to tell them each and every problem that you're having. Had I told my doctor that my oncologist at the time, because I was seeing him for lupus, if I had told him that I was having flushing episodes, he would have picked up a little bit sooner that I had neuroendocrine. But I didn't say anything because I just assumed everything was my lupus. You need to remember that not all your symptoms are connected to carcinoid or neuroendocrine. You can have a secondary problem. So make sure that you tell your doctors about those issues. This is really, really important. And make sure that when you go to the doctors that you also get your medical records. Those records are yours. So make sure you get copies of your CDs of your the CDs of your CAT scans. You get your reports for all your blood work. Keep a binder and make sure that you have that binder with you when you go to doctor's appointments. This is very helpful, especially if you're going to see a specialist. Then you have all your paperwork in one area. It's also good to bring somebody with you to maybe speak on your behalf. Sometimes, especially if you're older, you might not hear everything. So ask the doctor if you can bring somebody in the room with you, or if you can record your conversation to go back to later on. So these are reasons why we really need to be our own advocates. And, if you have any questions or concerns, you can always reach us. Call call our cell phone, call our hotline, come to our website, email me. I'm more than happy to answer any questions or concerns that you may have. No, we are not doctors, but we have been dealing with this. We cannot give you medical advice, but we have been dealing with this a long time, and we have dealt with hundreds of thousands of people each year, talking to them. Like I said, I've been doing this for 19 and a half years, so we have had quite a bit of experience. Is there anybody out there that has any questions? Please make sure that you visit the hospitality booth, and I'll be more than happy to answer any questions you have. Now, I want to bring up Dr. Wahmann, who is our morning's moderator. He trained at both NOLA and at the University of Kentucky. NCAN is so grateful to be able to work with him and for the work that he's done in the NET community. And we're very honored to have him as a medical advisor. NCAN has worked on several projects, including papers, one that was presented at ASCO GI this past January, and one that will be presented at NANET in October. So welcome, Dr. Wahmann.
Thank you, Maryann. Good morning, everybody. Can you all hear me loud and clear? Great. My name is Wahmann, and good morning, everyone. First of all, I would like to thank Maryann, Bob, and the team of NCAN for giving me this wonderful opportunity to moderate the morning session, and also giving me the opportunity to introduce our renowned speakers for this morning.